hopefully keep pace with some of the variants that we're detecting these days. And just regarding variants, we're getting now some good data from the CDC on that. And so if you want to go to the next slide, the website the CDC has out with the up-to-date variants. The slide here is from a couple of days ago, but if you go to the website, just search this for CDC US COVID-19 variants, you can see which variants have been detected in which states, and there's also a data table below that if you're curious. So, and I've got just one more slide. You might have heard some about the Johnson & Johnson vaccine, and sometimes it gets referred to as Janssen. It's the same one. And the nice thing about that is it's formulated to be effective at one dose, and it uses a technology that's been around for a number of years, but it's an adenovirus vector. And the data that we have, and I want to note that the data we have for the vaccines, almost all of them, it's coming out slowly, and we'd all like more. So we're being patient, but that's not the same thing as saying we don't know about its safety. All these vaccines so far look really safe. So, but this vaccine was found to be 72% efficacious in the United States, 85% against severe disease. So I think what we've seen from all three vaccines, including Johnson & Johnson, Moderna, and Pfizer, is that for protecting against severe disease, what we really worry about, these vaccines look really good. There's plenty more to come on these topics for sure. So at that, I'll hand it off to the rest of our whoever's next.
Hi there, it's Dr. Karin Shavelson. I'm the Chief Medical Officer at MarinHealth, and Dr. Cumming and I are both vaccinated, but you can see that sitting next to each other, we are wearing our masks. Can we have the next slide, please? Dr. Tolliver had one more slide, so we're not going to let him off the hook. We're going to give him his AstraZeneca slide.
All right, so this one's also in the pipeline, the AstraZeneca. And the nice thing about this, some data we got, is that it does look like it decreases disease transmission up to 2/3. So it also showed that if you space them out a little bit more, you got a little bit more efficacy. And that's something we kind of have been wanting to see for the Pfizer and Moderna, right? Because that might change the number of people who got their first dose. But this also shows at least 70% protection after the first dose for severe disease. So there's a lot more data to come, and just pay attention.
Great. If we can move on to the next slide. I'm going to go through this fairly quickly. It's a little bit of a test of your knowledge about the COVID vaccines, true or false. So we'll move through the slides. We'll give a pause for everybody to decide on their answer. I know for some of you, these will be too simplistic, but I think it helps us all have talking points when we talk to people who might have some vaccine hesitancy or questions. Next slide, please. So true or false? I've already had COVID, so I do not need to get the vaccine. Is that true or false? Next slide, please. So that is false. We still recommend that you do indeed get the vaccine. And you wonder why? And that is because it's not clear how long one's body will have natural immunity against reinfection. We know that reinfection is possible, and we don't know how long your natural immunity will last, but we don't think it would be robust enough for you to not be vaccinated. We think you'll get much better immune response from any one of these vaccines. The one exception to this is if you received a monoclonal antibody for COVID, you need to wait for 90 days to pass until you receive the vaccine. So you can work with your primary care health provider. Even if you're in the age tier that's being vaccinated, you've got to wait those 90 days until we can vaccinate you. I know that's a small number of people, so that's an exception and a rarity rather than a rule. Next slide, please. Once I've had both vaccine doses, I don't need to wear a mask anymore. True or false? Unfortunately, Dr. Cumming and I give the answer to that one away. Next slide, please. So trust me, as tempting as it is to not wear a mask, as much as we're all incredibly sick of it, we do still need to wear a mask. We need to socially distance. We need to wash our hands. We need to limit our gatherings. As I'm often heard saying, our lives should not change dramatically at this moment as a result of the vaccine. We need to keep being diligent. We also don't know if somebody could be an asymptomatic or mildly symptomatic carrier. So it's possible you could be vaccinated yet still spread COVID. We don't know yet. It's something that we want to make sure can't happen. The vaccines that are currently being used, Moderna and Pfizer, are 95% effective. But remember, you may have the unfortunate outcome of being one of the 5% who don't have full immunity, and or you could possibly still contract a mild disease. The good news is we do believe that the vaccines reduce the severity of illness, as you saw in the slides that Dr. Tolliver showed for the 2 vaccines that we'll hopefully see in the United States soon. So the basic message is the herd benefits. We as a herd, we as a group benefit from every single vaccine given. But until enough of us have received it, we have to continue these safety measures for the time being. As onerous as they are, as much as none of us like it, we're not off the hook just yet. Next slide, please. True or false? The vaccine will not impact a woman's future fertility. Next slide, please. That is true. So one of the biggest reasons we've heard amongst healthcare providers as to why a woman of childbearing age doesn't want the vaccine is she's afraid that it'll affect her future fertility. It's a very unfortunate rumor that began on a Facebook anti-vax site that has since been removed by Facebook, but unfortunately the misinformation did spread. We know from the human studies for Pfizer that there were women who did get pregnant during the study. So we don't believe that it affects a woman's fertility at all, and we believe it's very safe for women of childbearing age. We also know if you contract COVID and have the unfortunate outcome of being a chronic COVID patient, that will affect your fertility just by virtue of your illness. So there's many reasons to be vaccinated, and worrying about fertility in the future is not a reason to skip being vaccinated. Next slide, please. So I heard that people feel lousy after the second shot, so I'm going to skip the second shot. True or false? Next slide, please. We know from some of our surveys that there's a fair number of people that are worried about the side effects of these vaccines. I believe that everybody on the panel, I can't speak for everybody, but I know all the physicians have been vaccinated and we've both received our second vaccines. And yeah, you feel a little bit worse after the second shot. I was thrilled. That is good news. It means that the vaccine is behaving exactly like we want it to, as was my body. The first shot showed my body what COVID looks like. And so my body said, this is an enemy and I'm going to amass an army. I have an army of antibody. So when I got the second shot, my body said, well, I recognize this enemy, and did a fabulous job of organizing, recognizing, and defeating the enemy. And that's part of why I didn't feel great. It didn't go on for long. It wasn't anything bad. It's nothing near COVID. And I had a little bit of a sore arm, but I can say it was nothing like the soreness in my arm when I had my tetanus booster. So we should all be pretty accustomed to having a sore arm for a day or two. I can promise you it didn't slow me down at all. So most often, almost exclusively, the symptoms after the second shot are very, very mild. And at worst, you might need a little bit of Tylenol or ibuprofen. Next slide, please. This is our last one. So can you get a text from Dr. Fauci after you get your vaccine? True or false? Next slide, please. Well, if you're marginally tech savvy like myself, yeah, you can get a text from Dr. Fauci. So there's a great program through the CDC called vSafe. It's a smartphone-based app that uses text messaging and a web-based survey. You'll get really, really simple, super easy sign-up instructions at the time that you're receiving your vaccine. You have a fabulous opportunity to sign up for vSafe because if you didn't know this, you will have to be observed for 15 to 30 minutes after you receive your vaccine dose. So I encourage all of you, please sign up for vSafe. What it does is you get to report on your symptoms. And this is going to really help the CDC keep track of the side effects that any of us are experiencing with these vaccines. It's also, it's really easy, it's really quick, it takes almost no time at all, gives you a good reminder as to when your second dose is due, and you can change on your phone who's sending you the text message. It can come from Dr. Fauci, it can come from your mom, you can pick, your dog can send you a text reminder to check in about how you're feeling, whomever you wanted. But please consider signing up for this program. It gives us all a way to contribute to understanding more about how this vaccine works and how safe these vaccines are. I believe we will now move on to Dr. Willis's presentation. So that will require a quick switch in our presentations.
Thank you, Dr. Shavelson. Good evening, everyone. And thank you, MarinHealth Medical Center, for inviting me to join this panel. I just want to start by acknowledging the partnership with MarinHealth historically, and just the strong relationships we've had ongoing, and how much we've really needed to lean into that over the past year as we've tackled this pandemic together. And I think you heard from in Dr. Shavelson's presentation and Dr. Tolliver's how what excellent assets they are for us, both clinically and in public health. Karin, I feel like you really, you're a public health officer at heart, it feels. Thank you for those very strong public health messages. Are my slides up? Here we go, yes. So next slide, please. So I will just offer, this is, stepping back, not just vaccine, this is our experience of the COVID-19 pandemic in Marin County since the beginning. Our first cases were in March. Our first case was a gentleman who had been on the Diamond Princess cruise ship, if you remember that far back. It was also, unfortunately, our first death. We had 3 waves. That first wave, which is barely perceptible on this relative to the size of the second and third wave, was what prompted our initial stay-at-home policy, the shelter-in-place, which was the first such policy in the nation. Here, it implemented in the Bay Area. That the peak in July was primarily 80% of the cases there are essential workers or Latinx workers, and then we had, starting around Halloween, fueled by Thanksgiving, Christmas, and New Year's, surges in cases that really peaked about January 10th, and we've had steady declines since then. We've moved from the stay-at-home order into the purple tier and the California Blueprint for a Safe Economy. And now we are headed towards, if the progress continues over the next few days, we will probably enter the red tier, which offers us opportunities to open up more indoor settings, including indoor dining. Just the messages that Dr. Shavelson offered in terms of really needing to maintain physical distancing, covering our faces, and all those things we've been doing so well over the past year are going to be doubly important to allow us to continue to reopen safely. Next, please. So this is vaccinations. This is our, the data that I just shared and the data that I'm sharing here is all available on our website. We are really seeking to try and keep our community as well informed as we all can be. There's the website address at the bottom, coronavirus.marinhhs.org. And it's, if you haven't seen it yet, I encourage you to look and browse around. It has a lot of different information about demographics and the history of our experience thus far. We've added now information about our vaccine rollout process, including this, which is just offers on a daily basis, updated each day, the number of people who have been vaccinated. And I find it encouraging to look at this on every evening and just see the numbers as they rise each day. The light blue is the first doses, the dark blue is the second doses. We've now administered in for Marin County residents over 45,000 doses. And almost 36,000 residents, which is nearly 14% of our total population has been vaccinated. So about 1 in 8 residents of Marin County has received the vaccine. And if we take a step back and recognize who are those individuals that have been vaccinated, it is our healthcare workers, our phase 1A essential healthcare workers, our partners at MarinHealth, Kaiser, Novato Sutter Hospital, our primary care clinics, healthcare providers who have been on the front lines across the range, including our EMTs, our paramedics, all now, most have received both their first and second dose. So that workforce has been protected, which is a real game changer for us for the really duration of this pandemic experience. And then the remainder of those that have been vaccinated is moving into the age 75 plus group that we started vaccinating at the end of January. Next, please. These are the number of daily doses that we're administering. Again, these are for, I'm speaking when I say we, I'm talking about all the providers of vaccine across the county and others even outside of the county who may be vaccinating Marin County residents. And you can see on a good day, it's just over 2,000. This also shows that we haven't seen much of an increase in our supply over the past month. We are in a relatively steady state, and that has been part of the challenge that we've all been experiencing, and one of the primary themes of our experience of the vaccine rollout so far has really been just the scarcity of the vaccine itself. What's that meant in terms of the need for extreme rationing of the doses we have for much narrower groups than we would all want to be able to vaccinate. Next, please. This is the number of individuals that have been vaccinated in Marin by age. It shows the proportion in each age group. So it shows that, you know, as our strategy supported, we have vaccinated the age 75 plus. We're almost 60%. This was updated a couple of days ago. So, you know, because the data is about a day lag, and this was from yesterday. So we're probably over 60% now of our age 75 plus population across the county has been vaccinated. Huge progress for us. That is a group. 75% of our deaths are in our residents age 75 plus, and to have the majority of that group now vaccinated really predicts that our mortality rates will drop significantly just in the next few weeks. You know, we're expecting that our mortality rate for COVID-19 will drop in half by March, based on the progress we're making in this one age group. And that's important to recognize among all the concern and frustration that people are experiencing with the vaccine rollout. Also important to recognize the real successes that we've achieved, protecting our workforce, protecting our most vulnerable older residents. Next, please. This is just to try and clarify the way that the vaccine actually ends up in Marin County. Importantly, every single dose starts at the federal government. There is no way for any of us to procure doses directly. We cannot purchase doses. The hospitals can't get doses. Marin County Public Health Department cannot directly access doses. Everything flows from the federal government to the state, and then what we receive comes from the state. The state allocates doses to large healthcare systems like Kaiser and Sutter that have multiple presences across multiple counties and a separate allocation. And our Kaiser and Sutter hospitals in Marin look to their regional headquarters for the doses they receive. Marin County Public Health also receives doses directly from the state of California, which we then allocate to partners who are not part of those multi-county entities, including the points of dispensing, the Marin Center pod that we've mobilized, a large-scale vaccination site that can do about 1,000 doses a day, as well as MarinHealth Medical Centers is reliant upon Marin County Public Health for the doses that you're able to offer through MarinHealth. And then we're also supplying doses to other providers. And then separately, there's a direct federal program to CVS and Walgreens to cover residents of long-term care facilities across the county. Next, please. So this is just an example of how we use our doses. This is our allocation coming up. Every week we learn the allocation on Wednesday. So we just learned our doses allocation today for what we will be able to allocate next week. It's just a sign of how challenging it is from a planning standpoint. Again, we don't learn until on Wednesday what we're able to start doing on the following Monday. We learned that this is the most we've ever experienced in any week. We were given 9,000 doses from the state. Unfortunately, 6,000 of those are already spoken for because they are second doses. So we allocate those to whoever provided the first dose. So MarinHealth, for example, will receive something like 900 doses in order to cover those who had already been offered their first dose 3 or 4 weeks ago. And then we have 3,000 first doses that we can divide up from our points of dispensing. Again, that mass vaccination site I talked about at the Marin Center. We're also we mobilize mobile vaccination units to travel out to certain areas, and including long-term care facilities and assisted living facilities, and then mobilizing, sending doses to our healthcare partners.   for new doses. Next, please.   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 for new So what groups are being vaccinated in Marin? We have our healthcare workers. Any remaining healthcare workers are still obviously welcome to become vaccinated. Right now, I think we're really reaching the very tail end of that. We've successfully vaccinated almost everyone in that workforce. And then persons age 75 and older. And next week, we will be starting to vaccinate people age 65 plus, starting on Monday. Next, please. Why are we focusing on age? This is, it should be familiar. I know that Dr. Shavelson and others have shared this data, but in Marin County, when we look at our COVID-19 deaths, 15% of those that are infected who are above age 75 in Marin County have passed away from COVID-19. The mortality rate is high. And then among those age 65 to 74, about 4% who are infected, 1 in 25 will pass away. So, the age, the association between age and risk of severe disease and death is remarkable in COVID-19. And in the setting of scarcity, it really provides a very important organizer for our strategies for the dose allocations. A vaccine offered to someone age 75 and older is 332 times more likely to prevent a death than a vaccine given to someone age 0 to 49. So that was the rationale for adopting an age-based approach to our vaccine strategy thus far. Next, please. And then just for the public, anyone who wants to know when it's their turn to be vaccinated, I think MarinHealth also has a similar tool. This is on our Marin County website. It's our vaccine interest form. We have almost 50,000 residents now who have filled this out. Encourage everyone to go on. It takes about 3 minutes to fill out, just your name, your age, certain demographic information, your zip code, any medical conditions. And it allows us, when your turn is up, allows us to do proactive outreach to you and let you know. And then at that time, we'll be able to offer you a list of the settings in which you might be able to be vaccinated, because those will continue to grow over time as we move through the tiers. Next, please. And then vaccine options are also available on our website, and that will include both the Marin County pods that are open for vaccination, as well as some of the corporate partners, including CVS, who will be starting to vaccinate in their pharmacies next week. Rite Aid is also starting to be able to offer vaccinations next week. We have not seen any of the registration portals up yet, but we are being told from the state that that's going to be an offering available in Marin County. Safeway will also starting to offer vaccines, and these will be available. All of those options will be visible on the website. Just to set expectations, very few vaccines per day. Rite Aid, for example, will be offering on the order of 20 per day in each of their 4 sites. So those will fill quickly, but they will be just another tool in our tool chest to get our community vaccinated. Next, please. And I'll just end with this, this is the view of my office. My office is in the Canal area of Santa Fe, obviously one of our hardest hit communities. And this was our Department of Public Works setting up the mass vaccination operation we have here. We have a point of dispensing that can do 400 doses per day here. And this was the rainbow that appeared over that setting as they were setting up. Obviously speaks for itself in terms of the hope and the promise that we all feel as we're able to bring vaccines into our community. Thank you.
Thank you, Matt. This is Jennifer. This brings us to, oh, I hear a terrible echo. Okay, this brings us to our question and answer time. And I want to start by asking Dr. Shavelson and Dr. Griffith, Dr. Cummings rather, to tell us how MarinHealth patients can get vaccines, because I think it's a little different than what Matt said.
Jennifer, Susan has some slides. If you could go back to the original presentation that Dr. Tolliver and I did.
Okay, so I think you're asking if, and this would be, you want to go back to the original slides that Dr. Tolliver presented. Okay, so that's Deborah. Deborah, can you go back to those slides? Go back to Dr. Tolliver's slides.
And I can start with, because it is a handoff. So this is the handoff of my presentation to MarinHealth for this question reflects also the handoff of the doses themselves. flow from, as I said, from the state to the local health department and from the local health department to MarinHealth. So any doses that MarinHealth is able to offer are coming from the health department, and obviously it's a valuable partner for us. And we always try and make sure that we're offering proportional and the appropriate allocation, and wish we could offer more doses to everyone.
Okay, those slides are up.
So if we could move the slides forward. And then Jennifer, maybe if you try muting, I think the feedback is on your line.
Hi, this is Dr. Cumming. Actually, we need to go through Dr. Shavelson's slides to get to my slides, if you don't mind. So I'm the medical director for quality here at MarinHealth, and actually have been very active in a lot of our COVID activities, from testing and then most recently to helping stand up our vaccine clinic. Can you actually go through these true or falses, please? And what I wanted to say thank you first to Dr. Willis, actually, for really setting the framework to help folks understand what we've been doing here at the medical center. So to begin with, let's see, we just got a couple more. I think you had 5, right? Okay, we're almost there. Okay, there we go. Yay, thank you. Okay, next slide, please. So without being redundant, I was trying to emphasize also that our supply does come in fact from the Marin County Department of Public Health, and to just make that distinction that our alignment therefore is very tight with the county in terms of the tiers and who we are able to vaccinate. We started here actually with our employees, both our hospital and our network, and that program ran from December 17th through February 3rd. We just finished up our last batch of second doses. And it was a really amazing collaborative effort between our infection prevention team, nursing, and pharmacy. And you can see there that we did 2,679 individuals immunized. Our overall vaccination rate is very comparable to other healthcare organizations. And in fact, we are still have kind of a tail end. There were some people that were out on leaves or for various reasons didn't get vaccinated initially, but we are catching up now. And we are hopeful that we will be around the 80% mark when we're done with this. And you can see that includes quite a few of our physicians, nurse practitioners, physicians assistants, and midwives. So completing that, we actually overlapped a bit and started our patient vaccination program, which launched on the 22nd of January. And we initially started with the county guidelines, which was for our 75 plus. The goal, obviously, as Dr. Willis pointed out, is to really target those who are at highest risk for death. And that was definitely our older population. We have largely been administering the Moderna vaccine, and that's just the supply that we get from the county. We often have folks coming in asking if they can get Pfizer versus Moderna. And really, we as providers don't actually have a lot of choice. It's kind of what we get provided from the state. So we've been doing Moderna. And I'm really pleased that we have had very, very few adverse events. Next slide, please. So just to give you kind of by the numbers for MarinHealth as an organization, we, as of Friday, immunized 4,314 people. This includes obviously our employees and providers as well as the patients. And I want to focus now on that purple piece of the pie over there on the side, which is the 1,635 patients that we vaccinated. I should add that the clinic was open today and we added another 150 patients to that total. Next slide, please. So, the clinic opened in space in our old Cedar Pavilion, which was our old emergency department. I shared already the numbers, and the main limitation, and I think Dr. Willis made this point, is clearly vaccine, vaccine, and vaccine. All of us, and I think this really applies to Kaiser and Sutter as well, all of us are prepared to put more shots in arms, but we are just dependent on the supply at this time, and we are absolutely making sure that every dose that we have, it gets administered straight away. it has been an amazing spirit of volunteers, and we are actually staffed with, for example, one of our former chiefs of staff who's no longer working clinically. We have pharmacy volunteers. We've got just from our own internal volunteer pool coming to help support this clinic. And it's been a very strong collaboration. As you know, MarinHealth is a UCSF affiliated on the medical center and network. And we've had great collaboration, especially as it regards to the IT platform that we're using to support our clinic. And then medical center and network providers all working together. I think anybody who has worked the clinic will tell you that it has really been a joyful experience to be part of this effort. Dr. Willis showed you the rainbows, and just being in the clinic, I think, is a bit of a rainbow and sunshine for all of us that are participating. Next slide, please. This is really just about operations, and I think that it's just important to understand that setting these clinics up is no small feat. But we have really been focusing on how we outreach to our patients. We actually are using a bunch of different strategies to make sure that we bring in as many patients as we can, both those who are technologically savvy and those who are absolutely not tech savvy. Those who are at highest risk and those who may be, by virtue of age are still at fairly high risk, but perhaps don't have as many comorbid conditions. So it's really a combination of using our technology system to send out invitations through the electronic medical record, but we also have a list of high-risk patients, using sort of what we would call a data-driven approach to make phone calls directly to folks and bring them into our clinic that way. And we feel like it's been working well, and never underestimate patient word of mouth. Can I have the next slide, please? So I don't want to go into too much, here, because we've already talked about supply issues. There are some issues just in terms of the cold chain storage, meaning that these vaccines have to be handled very carefully, kept at appropriate temperatures. One of the things that I have here is about our set doses per vial. We get told that they've got 10 and we schedule for 10 doses, but aha, surprise, several of the vials for the Moderna, as was the case actually with the Pfizer, often have an extra dose, and we are definitely not throwing those in the trash. We are pulling those up, and we have an end of the day scramble, and we call in patients who are within the tier to come and get these doses. We also just need to, obviously, within the space that we have, and Dr. Willis was talking about having larger pods. One of the things that constrains us a little bit is just the size of the space that we have, and making sure that we continue to have social distancing and have space to have these folks sit for either their 15 or their 30-minute wait time post-vaccination. The other thing for our older age group, which should be no surprise, is a lot of them come with wheelchairs or walkers or caregivers, so you need space for those things as well. As I mentioned, the IT, we have the great fortune to have UCSF's version of the EPIC electronic medical record to help support this. It's called APEX. And they have a very nice build to support our clinic workflow, which makes things very efficient for us in terms of we give all patients an appointment before they leave for their second dose. And we also do all of the required reporting to the state immunization registry, which is important for the state to know that we are using the doses that they've allotted to us. Other than that, as I mentioned, we do our stuff with a lot of volunteers, and it is, as Dr. Willis said, sometimes a week-to-week thing. So once we know we've got doses, we go. Next slide, please. These are just some of the folks in the clinic. We have our volunteer pharmacist over there on the left holding up a vaccine, and one of our front desk people. Next slide, please. And this came actually from a patient with this inscription on it, and this is really above all while we're here. And so it was nice to have the chocolate, but above all, it's been just really an amazing experience to be able to get these vaccines into our highest risk population. And we're looking forward to being expanded to a larger population in the weeks moving forward. So I thank you.
Thank you so much, Dr. Cummings. At this point, I think now we are ready to move on to the question and answer portion of the evening. All right, so let's get started with that. So to begin with, and we've had a number of questions, and there's still more that have been coming in with chat, but many of our questions have concerned people that have comorbid conditions that are perhaps not in the prioritized age group. So for example, are cancer patients scheduled for vaccination after the 75 plus age group? Matt, Dr. Willis, if you could describe a little bit about how vaccine prioritization is going and how people with comorbid conditions that might put them at serious risk are being dealt with.
Yeah, it's a great question. So we have some discretion at the local level over which groups we will prioritize, and we also don't have control over some of that. So the state has makes the rules about which groups can be vaccinated. Right now, we are in tier 1 of phase 1B. I know the language gets complicated, but we went through phase 1A, we're in phase 1B, and we're in tier 1. And that includes anyone above age 65. This is the state's rule, anyone above age 65, and then others based on occupation. So essential workers, educators, food service workers, agricultural workers, and certain emergency services workers. That's the current state rubric. We are required to stay within that rubric. It does not currently allow us to prioritize individuals based on medical conditions who are outside of those groups. We can prioritize based on medical conditions for people who are in those groups. So, for example, if someone who's age 65, in Marin County, there are 33,000 residents age 65 to 74, and another 23,000 residents age 75 plus. So even within that group, we will have to sub-prioritize, and that's a good opportunity for us to reach out to those members in those age groups who might be at higher risk based on conditions like cancer. But when we talk about people who are less than age 65, the state has not yet offered us permission to prioritize individuals who are at lower age based on medical conditions. That may be changing, and I want to be clear that as every element of our response has been thus far, this is adaptive, it's flexible, and it is changing. And we are hearing that the state may revise their criteria to make it friendlier to physicians who seek to vaccinate their younger residents, or their patients less than age 65 who may have more serious medical conditions. But that's not currently allowed in the
Matt, can we just pause for a moment? We're having terrible feedback issues. Is there a way you might be in?
Yeah, I'm sorry. Yeah. I'll log out and come back in.
Or use your cell phone and switch your audio to a phone. You have that option for audio video. Okay, well, I'll ask a question that's not for Matt next. Okay, so we covered how MarinHealth is going to be reaching out to people. That is a question for Matt. One of the questions is, are there any expected side effects if you are older? So if you are an older person, is there any difference in the side effects that are expected based on age?
I can do that if you guys want. Can you guys hear me okay?
Yes.
Yeah, so in general, the strength of your immune system declines with age, kind of like your muscle strength does. So older people might not have quite the side effect from the vaccine that a younger person might have, but it is very variable. And those side effects only last a day or so. They're just so insignificant compared to the real disease. I just don't think people should really think about the side effects and really think about protecting themselves and their family and friends around them so they don't spread the disease, which is often, at least half the time, spread without them knowing it.
Thank you, Dr. Tolliver. And I've got another question for you. What do you anticipate the impact will be of the new South African variant being detected in the Bay Area?
Yeah, that's a good question. And I don't think anybody has a perfect answer right now, but it is a variant of concern. So it didn't get that, name really or designation without being a bit concerning. So I think that the CDPH and Marin DHHS are taking steps to carefully monitor the situation. But we do have concerns that it's going to increase cases in April. Some of the models are there. So it's hard to say at this point. I do think that the vaccines that are available, the Moderna and the Pfizer right now, are going to provide some level of protection against the South African variant, and I think that's an optimistic note. So more to come. Oops, Jennifer, you're on mute.
Thank you. Well, here's another question that it could be answered by you or Dr. Cummings. How will people be protected how protected will they be once they get a shot? How safe will I be once I get a shot?
You want to take it, Gregg, or would you like?
Yeah, sure. So it takes time. It takes time to develop that full immune response. So and it gradually goes up, but after 21 days, you're going to have over 50% protection from severe disease, which is what really the trials are looking at. So you know, one week later, that's not good enough. Even 2 weeks later is not good enough. It's a curve.
Okay. We're getting several questions about how to sign up for vaccines. And I guess the issue is that we've got Kaiser patients, we've got MarinHealth patients, and we've got patients that are in neither Kaiser nor MarinHealth and maybe get their care elsewhere. Is the best approach to go through the county when that website opens, or should they try to sign up with someone else? And this is probably a question for Dr. Shavelson or Dr. Cumming.
Yes, I'll let Dr. Cumming fill in too. So the biggest message is you should get vaccine anywhere you are able to and anywhere that it is offered. As Dr. Willis described, there are more opportunities coming. I think we've all heard about the Oakland Coliseum. San Francisco has the Moscone Center, which will eventually open up to non-San Francisco residents. The county has a interest form that patients should definitely fill out. That is one other opportunity within Marin County. Kaiser and Sutter, I can't speak to their exact operations, but I believe that Kaiser has an online sign up for their patients, but I don't know the details. What we've chosen to do here at MarinHealth, because of the limited, ever-changing vaccine supply, we are only opening up the next week's appointments at the end of the week prior. As Dr. Willis said, we don't know until Wednesday what our next week's supply will be. So we don't want to open up a bunch of appointments and can't get enough vaccine to serve those appointments. And so we have found it easier that once we know what our vaccine allotment will be, that we push out invitations using our electronic medical record, as Dr. Cumming described, and reaching out to specific patients that have been pre-identified to fill our appointment slots. So that's the method we're taking right now. This week was a very paltry vaccine supply. We only received approximately 200 doses total for the entire week. So just again, to emphasize what Dr. Cummings said, vaccine supply has been an ongoing challenge. It's also a big scheduling challenge when you only find out a couple days beforehand what your supply will be for the following week. We haven't even mentioned that the second dose requirement adds a layer of complexity. With Pfizer being at 3 weeks and Moderna being at 4 weeks, the social distancing that Dr. Cumming described, it will impact our first dose accessibility even when we have good supply. So there's a number of reasons that there aren't as many appointments as we know all of you wish that there were. We hear your frustration. We're working hard. We're doing everything we can to get as many vaccines into as many arms as possible. I can tell you at MarinHealth that we empty our shelves at the end of every week.
Yep.
We do not sit on any vaccine.
No stockpiling.
We use what we have.
Okay. Here's another question that I think that will probably be good for you too as well. My 95-year-old mother, she's had 1 vaccination so far, had some recent health setbacks. She's at home and family members, young and old, a few of it had at least 1 vaccination, are going in to care for her. What can we do? What are the COVID rules for a family from 6 to 8 households members? You know, so they've got multiple people coming in from 6 to 8 households to care for this person. Should they mask indoors or not? Should they eat together or not? And what other measures should they take to make sure that they are protecting her?
So I'm going to also just kind of call on Dr. Tolliver as well, but I think in that setting where there's multiple people and the vaccination status isn't uniform, it's very important that they continue to mask indoors. She, remember, after only 1 dose of vaccine doesn't have, you know, full immunity. And so in order to make sure that she remains safe and all of the other folks who are collaborating to take care of her, they want to make sure to wear masks. I personally, I don't know how Dr. Tolliver feels. I personally would feel that probably having meals together where there are people mixing from different households is still not safe at this stage of the game. We're not, you know, obviously still in that sort of shelter in place, but indoor activities are still really very risky if you're mixing people from other households. And I would welcome, you know, Dr. Tolliver, Dr. Willis to comment as well.
Well, if one of those family members is a designated caregiver, then they can be designated as a healthcare worker, and they can be vaccinated as well. And that might be one of the best plans, to have that person, if they get vaccinated, be the designated person who spends more time with your elderly family member.
Great, thank you, Dr. Tolliver. At this time, I'm going to ask our IT person. I see that Dr. Willis has rejoined, but he is now down there in an attendee. So if you could please elevate his phone line to a panelist so that he can reply to comments, that would be terrific. Okay, so let's move on to another question while we're hoping that Dr. Willis gets elevated to a panelist so that he can answer these questions, because there are several that are appropriate for him. Oh, is that you, Matt?
I hope so.
All right. Oh, good, good. Okay. All right. So we've had a couple of questions about whether or not people who can Kaiser. So apparently, let me get here. Here we go. So a person was unable to get through via phone yesterday to get an appointment for COVID vaccination. So they went to the website. Following the directions, they were given a choice of locations all over the Bay Area. This person selected a Nevada site, as well as was offered sites in Nevada as well as Sonoma County, and was given an appointment in Santa Rosa. This person's checking to make sure that since MarinHealth approved the appointment, this confirms that Marin County residents can get vaccination shots in Sonoma County.
Yes, and it sounds like that was someone who's a Kaiser patient. Is that right?
Well, it's a little confusing because they say MarinHealth approved it. So.
Okay. Yes. So the answer is yes. We all need to be opportunists in this environment, and the fact is, especially in our multi-county entities, the reason that Kaiser and Sutter are classified differently than MarinHealth is that they are multi-county entities. In other words, they span the region. And the way those regional entities approach this is to offer appointments at their next available site, wherever that might be across the region. So it is not uncommon for Kaiser members to be vaccinated outside of Marin. And similarly, when appointments open in Marin Kaiser, they are sometimes filled by people who live outside of Marin County.
Okay, this is another question for you. This is a question about a 62-year-old female. She was diagnosed with cancer and cannot start treatment until she gets a vaccine. But the medication and the vaccine need time between them. And during that time, the cancer is going untreated. So this gets back to the question about people with comorbid conditions. Here, this is a person who has cancer. Given that we had audio challenges before, I think it would be great if you could address the challenges of comorbid conditions and what happens in a situation like this when you've been diagnosed with cancer, but you can't get your treatment until you get your vaccine, but you're not in the right age group for a vaccine just yet.
Right, and I don't know how much, I apologize for the sound. Is sound okay now?
Yeah.
Yeah, okay. Yeah, I don't know how much my previous answer got through, but basically, there are things that we have control over and things that we don't at the local level in terms of our decision making regarding who is eligible for vaccine. Right now, the state rules are that we cannot favor people who have medical comorbidities who are less than age 65 for vaccine because they are not classified in Tier 1 of Phase 1B. That is under review at the state level. and that may shift, but right now, phase 1B, tier 1, which is where we are, is anyone age 65 plus certain essential workers, food service workers, agricultural workers, school staff. We are in Marin not even able to move to those people who qualify by virtue of occupation because we have so far to go with just our older residents who are at such higher risk for serious illness and death. But we actually don't even have structural permission from the state to vaccinate younger residents who have medical comorbidities who are not part of those occupational groups.
Okay, so then first responders, we got a question from a first responder that actually works at the Marine Mammal Center, which is interesting. And this person has paperwork from Marin Medical Center Hospital indicating that they should be considered a frontline healthcare worker. How can they convey that information so that they can receive a vaccine?
Yeah, if they're able to, our phase 1A, we're almost done with phase 1A. It's been healthcare workers, and then it's expanded beyond healthcare. What we would consider, traditionally consider healthcare workers includes pharmacists, people who work in laboratories, veterinarians who ended up being included in that group. And so the way we approached that was that people needed to be able to provide licensure and documentation at the vaccination site. Obviously, they need to endorse that when they sign up for the appointment, but then also furthermore, when they arrive at the site, they need to be able to provide that documentation that proves that status, and then they're able to be vaccinated.
Okay, and that would probably be the same for education folks too. Teachers.
That's right, later. And I want to be clear that we are not currently in Marin County vaccinating our food service workers, our agricultural workers, our educators, despite the fact that they're in tier 1. And that's because we just don't have the doses, and our strategy is really focused on saving lives primarily.
Okay, and that brings us to another question. Do you expect, what are the prospects for receiving a big boost in vaccine doses to administer? One person said at the rate that we're going, it's going to take 3 years to get everyone. So it seems like there's a pinch in the supply line. What are your thoughts about the prospect of vaccine being increased?
Well, I think to Gregg Tolliver, Dr. Tolliver open this up, which is, we're going to be seeing, the manufacturing is moving as quickly as it can. The products that have been approved are being manufactured as quickly as they can. We hear that Moderna has changed some of their practices, or are able to get more. We are fortunate to be living in the United States, that we are as a nation one of the recipients of the highest numbers of vaccines among those that are being manufactured and have been approved. The pinch point really does seem to be primarily just the manufacturer itself. It's the source, and we're all stuck. There's been a lot of media around where the blockages are. We know for sure, and our job in Marin County, and our MarinHealth has been a great partner, is to move the vaccine. As soon as we get it, we use it. So I can guarantee you that we are not storing vaccine in Marin. No dose goes unused for more than a few days. And that's just because we need to store them for the schedule for that week. But if whatever gods you might pray to increase the supply, please do, because that's what we're all hoping for.
Okay, along that line, if the Johnson & Johnson vaccine is approved and distributed, will individual doctors and nurse practitioners be able to give the vaccine in their office, as it only needs regular refrigeration?
Yes, I think that one of the great hopes of some of these less high maintenance, the Pfizer is really challenging from a cold chain perspective. It's negative 80 degrees Celsius, high maintenance vaccine. It's one of the reasons why we can't treat it the way we do flu. We'd love to be able to get these vaccines out as far and wide in every medical clinic. The problem is that it really requires such specific maintenance that we're really focusing on these large scale operations where we know we have the refrigeration, we know we have everything in place to do it safely and effectively. When vaccines that are easier to manage and more conventional, like what we would use for pertussis or flu, come out, like the Johnson & Johnson for COVID-19, I think that will open up opportunities to us have a much more diverse and widespread network of vaccine providers.
Okay. When do you anticipate that children or those younger than 16 or younger might be able to get a vaccine? We got a question about somebody who has diabetes and wondering about that.
Yeah, Gregg might be in a good position to answer that question. Dr.
Yeah, I can. Right now, there those trials are underway. So the kids, they're at the lowest risk for having severe disease. They do get disease, but actually there's been more and more studies show that schools are pretty safe. So I believe that the one of the Pfizer or the Moderna is okay, approved for 16 and up. I think it's the Pfizer. That's where we're at right now. I think those studies are going to be coming soon.
Yeah, we're waiting.
Maybe 2-3 months.
Waiting for the data. But Marin County, 90% of our schools are reopened to classroom-based learning, one of the highest rates in the state. We've had a total of 10 cases of school-based transmission, over 1 million student days now accumulated. So Marin has really been, I think, on the forefront of demonstrating that when it's done right, schools can be reopened safely. And that's all happened in the pre-vaccine era.
Okay, great. How long does it take once you get your second dose before you're fully immunized?
Before you're fully protected? After the second dose, 7 days.
Okay. Excellent. Okay, a couple of other questions, and I'm just going to squeeze one more in. I know that we are at time now and that we are going to go on. So somebody talked about that several of their friends under 75 had been able to get vaccinated at Kaiser. Why was Kaiser allowed to vaccinate younger patients when no one else could get an appointment?
It was one of the bumps and hiccups in this process is that there was an interval of time where Kaiser had opened up to 65 plus, and there was a rush for the door, and that ended up actually filling so many of their slots. And compared to the number of people who were actually eligible with that age criteria, they just didn't have enough vaccine. So they actually changed their strategy to be more narrow to 75 plus. So there was a moment there of a few days where it was open to a younger cohort.
Okay, last question. Is Marin getting less vaccine compared to other counties? People are feeling like, because they're hearing about other people in other counties getting vaccinated in lower age groups. What's your perspective on the amount of vaccine that Marin is being allocated? And is our age distribution being taken into account with our vaccine?
This week we got the highest allocation we've received thus far. It's also related to the fact that this formula has changed. The formula that was used previously was based on the number of healthcare workers in your given county, because we're in phase 1A primarily. That formula has now changed to reflect demographic characteristics, including age. And so we are now favored, and our allocation has increased about 7% now with that new formula. So that's progress. The fact that Marin County residents are getting vaccinated out of the county is not necessarily a sign that we are being under dosed as a county, because we are also vaccinating people from other counties in Marin. The network evens out. Okay.
At this point, I think we're going to have to finish up for the night. I will let people know that we will be posting the slide decks on the Marin Healthcare District website. So we had some questions about that. So people will be able to access the slides on the website. And I'm sure there will be a link to the recording provided as well once that gets posted. Thank you so much for attending. This is a moving, a changing rapidly situation. I know Dr. Willis is doing a number of webinars that the county also sponsors. So I encourage folks to check in with those to get the latest information with this ever-changing situation. And I want to thank all of you for the hard work that you're doing to keep our community safe. It's been a long time that we've been struggling with this virus. Seems like there might be a light at the end of the tunnel, and that feels good. And I hope that we can get there. And please, everybody else, we need to be patient. I know it's hard, but we do need to be patient. And our frontline workers and our public health staff are doing the best they can. So thank you all so much for participating today. And stay tuned for future Marin Healthcare District community health seminars. Thank you.